All right. Well, welcome everyone. Thanks for joining today's Falls Free Wisconsin State Quarterly Collaborative meeting. My name is Suzanne Morley. I'm a Health Promotion Program Coordinator with the Wisconsin Institute for Healthy Aging, or WIHA, and we convene the Falls Free Wisconsin Coalition. Love to hear from everyone who's on today. If you'd like to drop in the chat your name, and then a quick icebreaker if you have any summer traditions. So I'll share mine. Mine is Farm Market Fridays. So there's a really great farmer's market by me. And I like to take my son, who's 4.5. We've been going for the last at least 3 years, maybe 4 years now. And there's a splash pad and a park there and a bakery and coffee shop. So it's a kind of a whole day experience for us. So we'll just wait for some answers to come through the chat. Camping with kids in the backyard. See, I've thought about doing that, but I think I would just go inside in the middle of the night. Going to Devil's Lake, camping. Ooh, these are coming in fast now. On the lake in Door County and summer concerts. Annual disc golf trip. Travel around the state and play different courses. Evan, you'll have to send me any good course recommendations. My husband's been doing disc golf a lot lately. Going to the community pool. Farmer's market. Gardening, awesome. Camping, going up north, camping, Washington County Fair. I do love Washington County Fair. That's a good one. Trips with extended family, bike rides, R&R at a lakeside campground, and time with family near and far. Whatever my maybe wife tells me we're doing. Bob, missing a word there, but yep, I love that. That's all right. Soaking up every minute of sunshine and outside time that I can. Yes. My wife. Yep. I love that. Awesome. Well, thanks everyone. Hopefully you're all able to get outside today and this weekend and take part in some of those summer traditions. Agenda for today's meeting. So we have a presentation from Jill Rankin, who is WIHA's Executive Director. We're going to be sharing about reframing aging and fall prevention. Jill's also going to share a little bit about a federal grant opportunity that we have that's coming up about scaling the Stepping On program and study. I'll give some brief Falls Free Wisconsin Coalition updates, and if we have time, feel free to share any local updates, and of course, feel free to do that throughout the meeting in the chat as well, and then we will wrap up. So with that, I'm going to pass it over to Jill to talk about reframing.
Sounds good. Thanks, Suzanne. I'm going to go ahead and share my screen, get you guys some fun slides to look at. So great to be with you all today and talk a little bit about reframing aging and how that works and aligns with reframing fall prevention. So I'm going to start with just kind of an overview of the statewide Reframing Aging and Disability Initiative here in Wisconsin. Give you a little bit of backdrop and provide for you some resources and get you started on reframing today, actually. So you're going to hopefully learn a lot in the next 20 minutes or so, and then we'll have some time for questions. And then also want to hear from, I know some of you on the call today have been practicing reframing aging principles within your fall prevention work. So would love to hear any examples that's going on across the state. So in general, we basically had about 2 years ago, the State Department of Health Services, along with Wisconsin's Aging Advocacy Network, got together and realized that many of the barriers that we face to getting funding, getting policies aligned with aging and disability type issues and service needs was getting overlooked, and really explored the root cause of why that's happening. And there, along parallel with that, there's been national momentum on really the concept of needing to address ageism and ableism. And I'm going to talk a little bit about how those two things go together and how they are incredibly important when we talk about fall prevention. So we have this vision where everyone at every age and ability is respected, valued, supported, and belongs. And really, with the healthy aging lens, is able to remain independent and functioning in a community and giving back just as a part of every single stage of our lives. So we really set out to advance a complete story about aging and disability, and we do this by, we formed a, here's the next slide here. We formed a project management team here in Wisconsin. So led by the Wisconsin Department of Health Services, the Wisconsin Aging Advocacy Network, and the Wisconsin Institute for Healthy Aging. We really set out to try to figure out how to have a movement here in Wisconsin and provide education, awareness, and resources in reframing. So we formed an advisory committee, and that advisory committee meets once a month. And it's close to 30 people from multiple different sectors. We've got university sectors, we have healthcare, aging service, public health, UW Extension, lots of different people who touch aging within the state of Wisconsin that gather together on a monthly basis and really discuss, how do we move things forward here. We also have a champions newsletter, and I will have resources on the last slide, a little QR code for you if you want to sign up for that champions newsletter. And that just provides, we wanted to provide education as to how to reframe how we talk about aging and things like fall prevention. And then we also have a community of practice, and that is for people who have gone through trainings. Like, I'm going to do a mini version of the training for you today, who've gone through the trainings to reframe aging principles and get together and practice. Like, hey, how do I talk about falls differently? Here's a flyer that I have developed. And do we think that, what are some adaptations I can make to this flyer or this website or whatever it is to make sure that I'm utilizing reframing principles? So that's kind of how we structured the work here in Wisconsin so that we have the statewide support for the services and for us all to be learning together. So now jumping to the actual content. So why are we talking about this, and why, and what's the connection between ageism and ableism and fall prevention? So we know that ageism is we experience it in multiple different ways, and ableism as well. And I'm just going to pause for a second and kind of briefly describe the connection with ageism and ableism. They both exist at all these different levels, both interpersonal, compassionate, systemic, and self-directed. So we often think about the aging process as something that will affect our ability. So we think of it as I age, my physical and or cognitive abilities will decrease. That's a common stereotype. It's a common way of thinking. And as we know with fall prevention, we know that people think that falls are a normal part of aging. So this is a perfect example, and I guess I hate to use the word perfect, but it's an illustrative example of how we assume that aging means decline. Aging is going to mean disability. And when we think like that, when we have those stereotypes, that shows up in a variety of different ways. So in our interpersonal relationships, as we talk to people, we say things like, oh, you look great for your age. Or, oh, it's great to see that you're out and about at your age. Or great to see you're still driving at your age. Those kinds of comments we mean as compliments, but they are, as you can see, there's a root cause of stereotype in that. They have an ageism stereotype that's embedded into those interpersonal conversations and interactions. And we start to then to assume that we're going to decline as we age. We also see it like in compassionate ageism, where, you're like, you hear like, people talk like elder speak is a way to that you might hear that, like, oh, sweetie, oh, things like that. So not that it has a bad intention, but that it can just it can make us feel like as we age, we're declining. We also know that there's systemic, there's also self-directed ageism. So when we have these things happening, it's going to it can discriminate on how we act to other people or to ourselves and how we feel about our own aging process. And you're going to see how that really shows up. So we made, for an example, the discrimination may be, forced retirement ages is something that you might see as an institutional ageism and how that shows up. You may have, obviously things maybe not designed for people with disabilities, parks, things like that. Those kinds of are different light ways that you might, I shouldn't say light, but just a light list example of ways that might happen. So we also know that ageism, while we tend to mean well to help older adults in our work, it's really in a socially acceptable form of ageism. So we may show pictures like you can see from this slide here. We may show pictures of older adults as needing help or as lonely and frail. And those kinds of things are kind of like everyday ageism that we think is common. Other ways it shows up are like greeting cards, the laughing, the jokes about getting older, the 100th day of school that our kids may have in kindergarten, where they all dress up as an older adult with a cane and say they can't walk, things like that. Those are just everyday pieces of ageism that we see, and there's certainly many, many more examples. But all of this is going to affect our independence and our belief that we can take control of our health. So we also know that on the flip side, that when you have a positive age belief that as you get older, they're not like it's a all rose colored, everything is wonderful as we age, but a more realistic view of aging, that we are learning as we age, that we have opportunity to engage with family more, that there's lots of different benefits that we have as we age. And when we have those positive age beliefs, our stress is reduced, we have an increased quality of life, and we even see through research an increased longevity by 7.5 years. So we also know that we have strengthened psychological well-being. We increase our self-advocacy when we have a positive view of aging, and we increase our engagement within healthcare and our communities. So more social connection, more empowerment, more mobility, more engagement in our communities, which all affects our falls risk. So this is very brand new research along Dr. Becca Levy, who did the initial research on the last slide, has done some new research now. And this is a national study. She was looking at older people and she looked at their age beliefs. And when someone had in the blue a negative perception of aging, then you can see that they don't have as much improvement in their physical functioning. On the green lines, if they had a positive age belief, they're going to have a higher improvement and higher physical functioning status, and same with the cognitive functioning. It's significantly higher when they had a more positive belief about aging. So with all this research, we brought in the National Center to Reframe Aging. They are the national experts in addressing these aging issues and reframing and providing us some strategies as to how do we start to talk differently about this? How do we reframe our work and fall prevention so that we can make a more positive impact? So they came to Wisconsin, and we continue to partner with them to develop trainings on how to do this. And this is, again, I'm going to provide to you kind of a condensed version of it today. So really what it starts with is knowing that we need to change our communication strategies. And we want to do that through intentional framing. So how we talk in the words that we use, and even the pictures that we use in our words. And in our materials. That's going to change the way we talk about aging, which then therefore changes our thinking and our community's thinking around the possibilities that we have for engagement as we age. And then this ultimately, obviously, will improve people's health, and it will lead to beneficial policy and systems change as well. So the best place to start is today, and that is recognizing that we all have these implicit biases. We all have stereotypes and assumptions as far as what we think the aging process is going to, whether it's positive or negative. But simply being aware of those implicit biases will reduce that ageism and that ableism. It will just the simple awareness that, hey, maybe aging isn't just about decline. Maybe falls are not a normal part of aging. That's just that awareness in and of itself is very powerful. So there's words that matter. So things like we want to try to avoid in our words that we've got a tsunami of aging population, that there's a tidal wave of older adults in our state, in our country. We want to instead talk affirmatively, like as Americans live healthier and longer and healthier lives, there's opportunity to provide supports. So we talk more about the opportunities and of the instead of being overwhelmed by the number of older adults that we want to serve. It's a different twist, but instead of there's a fatalism, and I'll talk a little bit about it more later, there's a fatalism sense that happens when you use those terms, and it feels overwhelming to people. It feels overwhelming to policymakers who will say, wow, like I can't touch this. This is a big issue. I can't fix this. Falls are such a big issue. I can't even begin to make an impact. That's how many people hear those words when we talk about the issue being such a big thing. So we want to just slightly reframe it to talk more about an opportunity that we have to impact people's lives. So that's just one example. There's other examples about using the words seniors and elderly, and this is really depending on cultures. We know that there's different words in different cultures, so just knowing your audience and knowing who you're talking to. But in general, for the majority of Americans, we try to use the word older people, older adults, and then we try to use the word we and us versus they and them. So that because we are all aging, we are all part of this process. We all have disability in some form or fashion in our lives, and it's a collective versus it's a you problem. So those are some examples of words. I'm going to kind of go past this a little bit because I wanted to get into some examples of some traps to avoid. So this is what we want to stay away from. And we all do this. So this is certainly not meaning to be like, oh my goodness, we're all using this up. We're in a profession. We are in the space of wanting to help people. But wanting to help people, when we use some of these traps, these individualism, this us versus them, and these vulnerability things, we may have very, very well-intentioned purposes for them, but it doesn't necessarily accomplish what we want it to accomplish. And that's why we're going to talk about these traps. So I'm going to dive a little bit deeper into each one of them. So the first one, and think about fall prevention and your messaging as I'm talking through these. So the first one is individualism. So those of us in health education, we're probably used to saying, eat well, exercise, do these things. If you do that, you will age well. We may or we may not intend to say exactly that, but that's where sometimes our messaging can lead. So what we really want to do is we want to empower people's individualism, but we also want to make sure that we are not saying it's your fault. If you don't exercise, then you're going to have disability. If you have a disability, then you can't do strength and balance exercises. You just want to try to avoid that, like that perspective of healthy aging means no disability, or healthy aging means I'm going to be running marathons. We want to try to avoid having that feeling of guilt if someone can't do all these wonderful physical things to stay healthy longer. So that's an example of individualism. Then I touched on this a little bit, and that's the us versus them. So we have, like I said, we have very good intentions. I used to talk like this all the time and say, we're helping older adults, we are doing this for them, those kinds of things, because we want to help. But when we do that, it sets us up for believing that we don't have any power over helping or funding or policies that can help older adults, because it's not our problem. It's not us, it's them. So, what we want to do is we want to shift more towards an us versus a them. So, if we increase support for older adults, others will lose out. That's not what we want. We want something like, as we increase supports, it helps all of us as we age. So, it's an us versus a them. Then we want to not necessarily, we want to stay away from the vulnerability trap. So when we have images like this image is a good one. This is an example of a good image. But there's definitely a fine line here of, yes, we want to have images of us helping others, but we also want to make sure that it's not in a way where it sets up somebody who is more able to be on a higher level, or feel sorry for someone who maybe is using a cane or a walker or is more frail. So we want to make sure we're telling a complete narrative. Not every older adult is frail and needs help, yet some of them are, and some of us have those different points in our lives that we need more help, and that's okay. But we also want to make sure not everyone, we book them into that category. So we don't want to assume fragility. We don't want to assume incompetence or dependence. We want to be able to provide services, but at the same time, really have that mentality of empowerment. And empowerment is really the word that I wanted to use there. So that's a trap that we want to avoid. And then this is a big one for fall prevention, is we want to avoid the fatalism trap. We want to avoid starting out with the problem, and I still do it, and still trying to shift that mindset. It takes a lot of practice, but we want to try to avoid starting with the problem. And I'm going to share some examples of how we're doing this in the fall prevention world, but we really want to start with the opportunity when we're talking to people about fall prevention. We want to start with, hey, we have we have these programs that help maintain independence and decrease falls risk, versus saying 1 in 4 older adults fall every single year. Wisconsin is the worst in the nation for deaths due to falls, and we lead with those stats. And it can be overwhelming for people who are not in the field, and it can disengage them from feeling like they have a way to provide solutions. So we want to avoid that, talking about that right away. We still will present those statistics, but it's not how we lead the conversation. So here's some strategies that will help us advance these principles to stay away from the traps, some things that we can use. We want to talk about the process of aging as building momentum. So what we want to communicate is that as we age, we have new insights, we have new experiences, and we can power up our communities. We have the blessing of being able to be more involved in our communities. I mean, these are just small examples, but we want to communicate that there is positive aspect to the process of aging. This is going to inspire a different story about aging, and it's going to reduce bias. But we also want to be careful of still being real. We know that there are challenges as we age, but there's also challenges when we're younger. So at every different age and stage, we have challenges. We have disability. We have different abilities. So what we want to do is make sure that we're just using that language and that thought process across all of our ages and all of our spectrums. Then we want to prompt the can-do attitude. We want to really ignite people's empowerment that we are creative, we are inventive, our state is inventive. We come up with solutions. We are problem-solving people. We've solved big problems before and we can do it again. So yes, we have a large aging population. Yes, we have a lot of falls to address. We can do it. We have the tools to do it, and just really emphasizing the can-do attitude. It will steer people away from that fatalistic thinking. It will encourage solution-oriented thinking, and it will cue our collective responsibility that we have to improve our communities together. And then we want to make sure we're explaining the supports that we need to live meaningfully as we age. So we can all rely on a web of services and supports throughout our lives. Like that's the idea that we're trying to communicate. And we can talk about the fall prevention initiatives and programs and services and assessments and everything that's happening that we're doing. We want to make sure that we are explaining that to partners, to stakeholders, to potential funders, to policymakers, and to all of us in our community as we age, that we have resources, we have things to do to live meaningfully lives at every age. I'm going to kind of skip through this because I think I touched on this already, but we really, again, want to communicate that disability and aging, it's all a normal part of our human experience. And most people are going to experience some sort of disability at some point in our lives, whether it's temporary or more permanent. So we really, again, want to just talk about that as a normal part of the living process and make sure that we are using the us versus them thinking. So now I'm going to shift more towards specific examples within our fall prevention world. So we have a committee through the Falls Free Wisconsin coalition that has been working on fall prevention messaging and a guide to utilize these reframing principles within our fall prevention work. So that is going to be available very soon. We are getting final approval from the national office who funded this work to then distribute throughout the rest of our state. So I am super excited about this. I know several of you who have worked on this are on the call. So thank you to Suzanne and Ashley, and Beth and Paul. I mean, we're all kind of working on this to make sure we have some specific examples of how we can reframe our fall prevention happening. So it's going to, talk a little bit about why. It has some statistics in it, and then we're going to have a lot of examples. I'm going to show you some of those examples today. So we'll dive deep into things like data. We'll dive into things like images. So for this image, you can see that a picture is worth 1,000 words. We have used images like the ones on the left before, but if we use images like the ones on the right, where you have someone still using a cane or a walking stick, but they're a little more upright, it doesn't emphasize frailty. And it's not that frailty is bad, but we want to try to shift the narrative to a more positive approach to what people can be like when they're more independent, yet still needed to use these assistive devices. So we want to make sure you're addressing your target population. So using appropriate images, and that's why we have the walking stick example. For example, when you're working with tribal elders. So that's just one example of images. And then there's another one on the right, same thing. You have someone who fell, who is not necessarily unrealistic, but as we're talking about potential and empowerment, we want to make sure we're careful about what images that we're using, that we're making sure that we want to really communicate the opportunity for engagement people have as we age. So here is an example of a stepping on flyer. So we have, before we used to use the words 1 in 4 people age 65 or older has a fall each year, don't be one of them. So now that we're learning some more of these strategies, we've shifted that language a little bit. And you can see the after on the bottom right-hand side of the screen. Falls might be common, but they don't have to be a normal part of aging. Stay strong, stay independent, stay steady with stepping on. So that's an example of more of an empowering message. We're not discounting that falls are an issue, but it's basically, it's a little bit more engaging, and it's really emphasizes that independence, the opportunity for independence as we age. So here is an example of a social media post. Thank you to Aging and Disability Resource Center of Brown County. This is how they had reframed their message. So you can see the before and the after. In the before, you can see the picture of looks like a woman who looks like she fell in her bathroom, which again isn't bad. It's not a bad image to use. However, what do we want to do to engage people? We want to use maybe a different image of more possibilities, things like that. But also not keeping in mind that we don't want to provide images of like running marathons, because that's not realistic for all of us as we age. So a little bit more realistic image. And then you can see the language. Did you know, before it said, did you know that 1 in 4 older adults experiences a fall each year? As we age, our risk of falling increases. Those kinds of things were the before message, which isn't not true. I mean, it's true, but instead, after we're reinforcing as we grow older, we may notice changes in our balance, strength, and vision that make us feel a little less steady. The great news is that falling doesn't have to be part of the aging process. Together, we can take steps to stay confident on our feet. So just a little bit of tweaking you can see is a little bit more empowering. For those of you who hopefully, I think everyone probably on this call attended the Fall Prevention Summit that we had in April this past year, you can see that even just the title of what we had is using the word resiliency. And I've been trying to, I know in some of the communications working with legislators, trying to use that word a little bit more about how do we increase resiliency or falls resiliency. And then we can still use the word fall prevention and preventing falls. But sometimes when you talk about that resiliency and increasing resiliency, people listen just a little bit differently. So we had a great presentation in that. So encourage you to, I need to keep re-listening to that to try to get it kind of embedded into the way that I talk too. So encourage you to check that out if you haven't seen that presentation, that keynote presentation on the resiliency piece. Okay, here is an example when we're talking about data. So I talked a little bit about fatalism and staying away from just that, talking just about that fatalistic statistics. We can still keep it in there, but it doesn't have to be the top thing that people see. So when we were advocating for the healthy aging grants, the fall prevention grants, we used to just right away talk about older Wisconsinites being sick. There's a lot of them. It's 1 in 3, which is true, and we want to still say that. But this is how we reframed that this last year. Aging is a lifelong process that connects us all. Today, 1 in 4 Wisconsinites is age 60 or older. So all we did is just add a more broad positive statement of inclusiveness, that we are all aging and we're all connected before we start talking about that stat. So somebody is engaged in this and they're engaged in the solution right away versus an us versus they approach. And then we avoid that fatalism we really highlighted, like, for example, the impact of the Stepping On program and how we can improve health and quality of life through all of our fall prevention programs. We highlighted that stat in the green versus highlighting the problem that there's $1 billion spent in Wisconsin annually on falls related health costs. So it's still in there. It's just not in the highlighted part of it. So in closing, how we want to get started. We can make small edits to fact sheets. Sometimes it's a little bit overwhelming to say, oh my goodness, I need to change everything I have. It's a little bit easier, we found, those of us who have been working in it, to just start with whatever you're designing that's new. If you have time to go back to your old flyers, great. But just kind of like from here on out, maybe just think a little bit more about the words, make those small edits to them. The easiest edit to first make is changing our words from to we and us instead of them or they. That's a really easy way to just quick shift that. And then you can start, utilizing some of these other principles. But again, flip the script. Instead of introducing with your scary stats, begin with the opportunity. Be thoughtful about the images that we're using, and you can just keep saying we're all aging and the aging process here in Wisconsin. And just that in of itself can really catalyst some big change. So here is a QR code if you want to get connected to our Aging and Disability Champions list. You'll get opportunities for more in-depth education on these reframing principles. And then please stay tuned. I'm sure Suzanne is going to be sending out, as soon as we get approval on the reframing fall prevention toolkit, that is going to be available for us all, and just encourage you to take a look at it and start utilizing some of the principles. So I will stop there. Oops, I'm going to keep that up and open it up for maybe some comments. So I know a few of you on the call have already been doing this work. So does anybody want to utilize any examples or have any comments on the process of reframing that you want to share?
I can share in Dane County just one small thing that we did. And I think, Jill, you're so right that the first step is just acknowledging, that like, oh, the way I use language really does matter. And even shifting and presentation shifting um, them or they to us, we're all aging. Like this is something that we're all fortunate enough to do if we're still here on this earth. And what does that look like as we continue to do that? But we give a presentation in lots of different settings in Dane County. And just a year ago, we started with all of the doom and gloom statistics and so we didn't actually change the presentation. We just changed the order of how we presented the content, and we moved up the more positive, we're all aging and what does this mean? And then here are some local resources that might be beneficial, and then why? And then we moved into some of the statistics instead of starting with that. Um, and then the other big thing that we did, which it wasn't really big at all, is just adding the word resiliency to everything that we do. So it's falls prevention and resiliency. We have that's kind of our phrase now that we use. And that was actually feedback that we got from participants in some of our classes that were happening around town. So I think it makes a difference. It seems to. So those are just a couple of the small things that we've done in Dane County.
Great. Thank you for sharing, Ashley. And yeah, I know you've been on this journey for a little bit now, and it's great to hear that even feedback from your participants and community members is on that resiliency side. So that's great to hear.
Yeah, this is Ann Gallo from Waukee County. We release a tips of the month, and we've been doing that. Can't remember when we started doing that, but in that we always had statistics, and so we did find too that a lot of the statistics are a little negative. And so, in the last couple of years, we've edited all of them. We keep the statistics on there because we feel like it's eye grabbing, but we just changed them to be more positive. So, like the positive spin in it, instead of saying, this many people fall, it's the positive part of each one of the, because we did that for like each risk, like medications, exercise, home safety. And so we just flipped the statistic to be in the more positive light.
Right. Yeah, that's a great reinforcement of that concept, Anne. Thank you. Because you're engaging people when you're not talking about it right away, but then once they're engaged, then they'll pay attention to those statistics. It's not as overwhelming when they're already engaged with that initial message you're giving them. Yeah. Great. Well, happy to take any other examples or questions. Otherwise, I'll pass it back to you, Suzanne, and thanks everyone.
I'm gonna pass it back to you just for this one
yeah.
slide, Jill, before I start.
That's right. So speaking about potentials and possibilities, we are really excited to announce that the Federal Administration for Community Living has released new fall prevention grants throughout the nation, several of them. And the biggest one, this exciting one, is that they want to scale evidence-based fall prevention throughout the nation. So really a national movement on this here. So the work that we've all done, that you've all done here in Wisconsin, has gotten national attention. And so much so that they have picked the Stepping On to be the program, along with STEADY, to be the program that they try to, that we are aiming to scale throughout the United States. Sorry, I'm going to need to drink a little bit more coffee. So what that means is that we will have additional states. Right now, we have about 20 different states in the nation that, excuse me, are doing Stepping On, and then a lot more that are doing other great evidence-based fall prevention programs. So we're trying to provide like a complete approach to fall prevention, and even areas that are doing awesome things like bingo size and matter of balance and some of the Tai Chi programs that are happening. Also then providing Stepping On and providing kind of a complete package for people. So that opportunity, what that's going to look like here in Wisconsin, we will be applying for one of these grants. We will be servicing other states, but we will also be applying for that grant. So I'm meeting with a handful of you over the next couple of days. So thank you in advance for those meetings. I'd love to get your thoughts as to what it would take to scale Stepping On throughout the state of Wisconsin and incorporate more steady processes throughout our healthcare system. So we're going to work on expanding that. It'll probably be what we're thinking is like having a learning collaborative for healthcare providers, EMS providers who are looking to incorporate the STEADY risk assessment and referral into their processes, whether it's with community paramedicine programs or in general processes or in our healthcare primary care settings, wherever it is. So we'll be working with a wide spectrum of healthcare partners to incorporate STEADY into existing systems, and then also providing implementation stipends, implementation incentives to scale up Stepping On, especially in those areas where STEADY referrals can be filtered into the Stepping On program. So more to come on that, but we are looking to, this is a very fast turnaround. We need to get the application in about a week and a half. So what we really want to make sure that is we're supporting all the great work that you all are doing and build that into our grant proposal. So that's that.
Awesome. Thanks, Jill. All right, so I'm going to jump into some Falls Free Wisconsin Coalition updates. And I believe we sent this out a month or two ago, maybe before then, but we wanted to share again. We have our updated Coalition Quick Guide, and I'm actually going to go to our website and talk through the updates here. But if you haven't seen our Quick Guide before, this was something that was developed first, I think either in like 2021 or 2022. And it's based on a guide from the National Council on Aging, but it's really meant to support the development and sustainment of local fall prevention coalitions. So we have 11, maybe more local fall prevention coalitions like at the county or regional level here in Wisconsin. We would love to have even more of those. So if you are in a community that doesn't currently have a local coalition and you're looking to start one, you can definitely use this guide. And or if you are in a community that has one, but you're looking for some different tips and tools for sustaining a coalition, this is the place to look for sure. So the majority of the information is the same from different iterations. We did reframe it quite a bit from what we've been learning with reframing aging principles that Jill just shared. But I just wanted to highlight a few sections here. So we have our getting started, where it talks a little bit about like the benefits of a coalition and it's some resources to start one. Then going into the formation state, so identifying key partners, making the case, so looking at data, and then creating a planning group. And then kind of the maintenance phase there. So creating some foundational documents like strategic plans, recruiting coalition members, what members should be at the table, the initial kickoff meeting, and scheduling meetings and things like that, and communication, and then identifying objectives and actions. And then there's the institutionalization stage. So maintaining that coalition and keeping the momentum going, sustainability, obtaining funding, creating methods for sharing the work. And then there's some examples of social media posts and different things like that. The most exciting part of this document that we made quite a few updates to, I think, is this case studies or appendices. So previously we had just a couple of different examples, but now in our appendix, we have examples from urban and rural local level fall prevention coalitions. So Milwaukee, and these just give an overview of the coalition successes, challenges, lessons learned. Then we have Fond du Lac County, who is a newer coalition. I think they've been around now for 2 or 3 years. And I know they use this guide to develop their coalition. Waushara County, Russ County, again, one of our newer fall coalitions. They've been going now for maybe about 1.5 or 2 years now. Portage County, some example about, Fall Prevention Awareness Month activities from Dane County. And then we have a great document from Brown County that goes through their goals and objectives. So again, just a really great resource if you're looking for any guidance on local fall prevention coalitions. And then a few more updates we did at WeHow. We hold a monthly Age Well series webinar. So our Age Well series webinar for this month, these are open to anyone throughout the state. They are geared towards community members, so towards older adults. But you're welcome to attend and share these out. The next one is July 30th, and the topic is food, fluids, and fall prevention. So if you did attend our summit, you heard from Pam and Christy from the Greater Wisconsin Agency on Aging Resources. Their presentation on nutrition and falls was super well received, so we wanted to bring that to a community level audience. So they'll be talking about, how protein and hydration and nutrition can help with fall prevention. And they also put together this guide if you want to hold a watch party, a community watch party. So stream the webinar live or view the recording at a community center or a library, whatever it might be. They put together this guide with some ideas for some protein and hydration tasting stations, if that is something that you'd be interested in. Another update from the coalition, our best practices work group has been working with some of our partners and recently developed a 3-part video series on medication management and fall prevention. So these brief videos, they range in length from like 16 minutes long to 23 minutes long. They're intended for nurses and other healthcare professionals who care for older adults. But we welcome you to share these videos with your local fall or injury prevention coalitions, with your local healthcare providers, and they're on topics of non-pharmacological intervention, the CDC study RX, and then the Beers criteria and falls. Another opportunity we have coming up is our data webinar, which is in about a month or so on August 11th. So if you haven't registered for that, I encourage you to do that. We'll be talking kind of data 101, how local communities are using data. So we'll get an example from Racine County Public Health. Deirdre from the Department of Health Services will be going through the recently released special emphasis report that talks about traumatic brain injuries. And probably not surprisingly, falls are the leading cause of TBIs in Wisconsin. And then we'll be going through the resources that we have available through the state as well. And then this is kind of the hot off the press update here. So we have Falls Prevention Awareness Month that is coming up in September. So we have resources available on our website, and our theme this year is Stay Steady, Stay Connected. We know that research shows that social connection is an important component of fall prevention, and older adults who maintain strong social connections tend to stay more engaged in their communities and relationships and engage in healthy behaviors like regularly exercising. So therefore they have better strength and balance. And then social isolation and loneliness, on the other hand, can lead to lower activity levels and declining strength and balance and depression and a greater risk of falling. So we're really focusing on this topic of building relationships and staying connected with community and family with our campaign. So we have some resources, and I'll go to our website again in just a minute or so. But we have some different resources available. The majority of them are now on our website, but more will actually be coming in the next week or so. But if you just go to For Professionals Promotional Resources, that is where you'll find everything. And then scroll down to Falls Prevention Awareness Month resources. We are doing a partner media contest. So we've done this the last couple of years and kind of switched it up every year. Last year we did a magnet and sticker design contest. The year before that, we did a placemat design contest. This year, we're really focusing on outreach, so encouraging you to outreach in your local communities with our media contest. And we have a tracking sheet for you to do that has different activities listed on there, like submitting a press release or newsletter article, holding a Fall Prevention Awareness Month activity, sharing social media posts, and more. And then you can earn points. And the organization that gets the most points will win a $100 prize. So we really encourage you to start with that contest. You can start now. And then the tracking forms will be due by Tuesday, October 6th, and we'll announce the winner at our next quarterly collaborative meeting on October 9th. Then we have our events calendar as well. So again, this is open to anyone that visits our website. So we will be doing some paid ads that will drive traffic to our website. So it will be a resource that many older adults throughout the state will be accessing. So we encourage you to visit our events calendar and submit if you're holding a Fall Prevention Awareness Month activity, a screening event, a balance and strength exercise class, whatever it might be. Feel free to fill out our short form, and then your event will get added to our events calendar. We are doing our community webinar on Thursday, September 24th. So again, this is part of our Age Well series, webinar series, open to anyone throughout the state to attend. And we have one of our coalition members who will be presenting on how social connection supports mobility as we age. So you're welcome to share the flyer. And then this is where you'll find our press release, newsletter article, radio talking points available in English and Spanish. And then another new thing we're doing this year is bus ads. So we will have bus ads in some of the major markets throughout the state. So Milwaukee, Dane counties, Eau Claire, La Crosse, Oshkosh, Green Bay, Stevens Point, Wausau. I might be missing one or two, but in the major markets, we'll be having some bus ads. So we put together some that you might be able to use in a local ADRC transportation bus, or if you have any transportation buses that you use within your organization. There's a couple different versions here that you can use. They have different, it's all the same message, but different images depending on your target population. And these are available. They are in 8.5 by 11 documents, but we encourage you, if you would like them in a different size, depending on your needs, you're welcome to reach out and we can resize those for you. And then this is also where you'll find that social media schedule. So like I said, I think we'll be adding just one or two more things in the next week or so, but the majority of information is there for you to start using and planning how to use in your local communities. Okay, and with that, we have about 5 minutes left. I'm seeing lots of stuff in the chat, so I'm just going to check that out. But if you do have anything to share, any questions to ask in the next 5 minutes or so, feel free to do that now. And Bob, yes.
I think Robert was wondering if something was going to be sent out. I'm not exactly sure what I think it was maybe the coalition guide, maybe.
Yes, we will be sending out all the resources that were shared. Our newsletter will go out probably sometime next week, thinking next week, Wednesday.
Right.
And I'll definitely connect with you via email, Robert, too. If there's any questions or comments or suggestions, things to brainstorm with who we have on the call here, you're welcome to take a couple minutes to do that.
Thank you all for doing such wonderful things in your community.
Jill, a question for you in the chat about the grants.
Well, yes. So if anybody has any insight, thank you for that question, Debbie. Any insight into the grants, please email me. I'm setting up meetings like now, and we need to kind of get the concept set in the next couple of days. So we are working with several of partners, several healthcare partners throughout the state right now in brainstorming what that looks like. So I also have a couple meeting requests set into some of our EMS partners. So if anyone has any insight into that, specifically in the healthcare and EMS world, as far as what we would need to put into that grant to help make it successful here in Wisconsin, please let me know, and or if you're willing to write a letter of support. So it's going to happen fast. I will put my email into the chat, and please, or put yours in the chat, and I'll be in touch with you if you have any assistance that you can offer to that. Thank you, Debbie.
Well, feel free to continue putting things in the chat, but I'll just wrap us up here. We do have one more meeting coming up October 8th for the year. I'd like to thank our 2026 Falls Free Wisconsin sponsor, UW Health and funder Trillium Foundation, for supporting Falls Free Wisconsin. And like I said, the recording of this meeting will be sent out likely on Wednesday of next week. And spoiler alert, be sure to view that newsletter for a new LEAF grant opportunity that will be released as well. Not seeing anything in the chat, so thanks everyone for joining today. And hopefully your plans for Falls Prevention Awareness Month go well, and we'll be excited to hear about them at our October meeting. Thanks, everyone.